Hello, friends. Welcome to Life and More Plus. Today, we explore a powerful shift in how healthcare is reaching India's underserved communities. Our guest today is Smriti Tandon, co founder of Online Chikitsa Mitra. From a decade in automobile industry to leading healthcare access platforms that connect patients, doctors, and medical stores, her journey is rooted in one core belief, and that is healthcare must be accessible, trusted, and a part of everyday life. Today, we'll talk about how medical stores are being transformed into digital care hubs, the challenges of rural healthcare in India, and what it truly takes to build systems that reach the last mile. Welcome, Smriti.
Thank you for that warm welcome. I'm looking forward to the interaction further.
Pleasure is all mine. So, you began your career in the automobile industry and then spent over a decade there. What
Yes,
made you move towards healthcare and social impact?
right. So over a decade, what I realized because after expanding business everywhere around in Uttar Pradesh, specifically in Lucknow, and being in a male-dominated industry, automobile, one thing that kept within me was that the amount of advances my HR was signing, and these advances were
Mm,
mostly for health-related concerns or either for a child's wedding. And I was astonished that, in spite of having a PFN, ASI, all the schemes that government would give, why would they still want to go and see a private doctor? That was a question that stayed with me. And on the side, my brother had already started working in rural healthcare. So it is something that was very close to us. And since we come from Lucknow, we've seen how the hospitals were overburdened, how the OPDs have been overburdened with all the people around, Lucknow, traveling to Lucknow in the government hospitals, be it to get even primary health care. So that was a question, what if they didn't have to travel? What if they got that first consultation in their own hometown? So that was the
okay.
main motivation for us behind it, is to bridge that gap, because see, there is a shortage of doctors, and it's not just in India, it's worldwide phenomena. The amount of specialists that we currently have around the world, and the amount of population we are serving, the ratios as per WHO don't match up. So the shortage cannot be, it cannot be that the shortage in overnight it would be fixed, or the government could do something about it and the doctors would be there. It takes a lot of efforts and everything. So we thought, why not use an established service? So telemedicine is a very established technology. It's not something very new. I would say that I don't know
Mm,
how many times we have taken online consultation by just WhatsApping our doctors and saying, I don't feel quite bright. What should I take? Is that not an online
mm,
consultation we are opting? So we said, why not structure it? So that's how Online Chikitsa Mitra came in. And we said,
mm.
have a structure, have a prescription, have a setup where people could rely on. And for their primary health needs, they could consult a doctor and they don't have to think for a long time. Also, not lose their daily wages. Because in rural India, we know how all the people are usually daily wagers, and it becomes very challenging for them to travel.
So, whose brainchild is it? It's yours or your brother's?
So my brother started Cellular Technologies in 2016. He graduated
Mm,
from US. He did his master's from MIT. He came back to India,
mm,
worked in Eureka Forbes, and he also worked on a pilot project in the US where underdeveloped
mm,
countries for children neonatal oximeters, where how could measure their oxygen and things like that. So this was
mm,
something very close to him also, healthcare. That there is
mm,
something that we should
mm,
do something about it. And because we do not come
mm.
from a doctor background, from a family side as well, none of us were ever in MBBS or anything. All that we've just seen is, growing up, we've seen our grandparents going very often to doctors or even relatives or someone, and everyone waiting long and far for a doctor, or let's say the doctor didn't turn up to the clinic because he had an IPD or he had an emergency. So all these
Mm,
primary healthcare, which and just an for an advice, if I'm spending 3 hours, how can I shorten that? How can we reduce that
mm,
time and the burden even on the system and the doctors? So it was a brainchild
mm.
completely of my brother. It's in 2022 that I joined him after winding up my automobile business. Basically, I sold it, um, and then I
Okay,
joined my brother. Yes, the company still
okay,
exists. The automobile is just that I thought to part ways with the company, and step in into my brother for expansion.
okay. And so, you and your brother are working now, like you're together in
Yes,
this.
Yes, right. We're both
Yeah. So
together in it.
uh, you mind telling me his name?
Shubhang. Shubhang
Okay.
Tandon. Yes,
Okay. So Shubhang and Smriti Tandon together have come up with this online Chikitsa Mitra. Huh?
right.
So that was in 2022
He came
or
up in
before that?
2016. So in 2016, my brother he started working in Uttar Pradesh, and he had his own
Hmm.
e-clinic set up. So what these e-clinics did
Okay.
was it was before COVID. So what these e-clinics were, they
Okay.
were in the hinterlands of India, like in Uttar Pradesh, I can name the basic areas like Suratganj and
Uh-huh.
Barabanki, Banthra. These are
Hmm.
very small districts, or
Hmm.
let's say somewhere in Balia, and then Gai Ghat, Basti. So these were very
Okay.
small
Okay.
villages, and where he'd open his
Hmm.
own physical setup. These physical setup had a
Okay.
doctor, online consultation, a nurse that would help them for the online consultation, and lab services as well. So all the pathology
Okay.
works, X-rays, they would run there. But what
Hmm.
happened, like when COVID hit, we had to
Hmm.
wind up a little of our operations. We had to, and also we were understanding that these people in rural, their first point of care is a medical store. It's not us. In spite of us giving them everything there, the moment we had a
Hmm.
doctor there, we had lots of patients coming to us. They would ask for free medicines, advices, and everything. But the
Hmm.
medical store was still the first point of care for them. It was like, भैया मेरे पेट में दर्द है गोली दे दो. So that was one line that hit us.
Okay.
मेरे को बुखार है मुझे गोली दे दो. कुछ
Hmm.
ऐसा करो कि मैं जल्दी ठीक हो जाऊं, because it came on their
Hmm.
daily wages and they wanted a quick fix. In rural, people want a quick
Hmm.
fix. They are not waiting for them to
Hmm.
complete the entire prescription or anything and follow it. So he understood that
Hmm.
we had to switch to something that was more powerful, and where we would fit
Hmm.
into the existing ecosystem and not be an outsider. So that's when in
Hmm.
2019 is when we started piloting our project with medical store owners. Today we've grown to 650 medical stores pan India, working in 15 states for now, but we look forward to expanding it further. And now what we do is we partner with these medical store owners. We set up an e-clinic there itself. We tell them, you give us a small space, you give us a gadget or something that you want. We would install our software there. We give you a training. We give them a training how to
Hmm.
take vitals of these patients as well, because we're trying to maintain a EHR also for the doctors. See, because if I
Okay.
cannot see the patient in front of myself, I may not be able to even deduce that what problems he really has. So this medical store, it becomes the main facilitator in there for me. They know
Hmm.
everything in and out about the patient, because they even know that how many people are there in his family, because they've been going to that medical store for generations. It's not that the
Hmm.
medical store exists just now. The medical store has existed
Hmm.
beyond when we entered, and will still exist,
Hmm.
continue to exist. That's the truth.
Hmm.
So it was important that we realize this and we step into the main picture and say, okay, fine, why not we work along with them rather than telling them we are an outsider, and give them that
Hmm.
healthcare that they really want. So now they have a prescription. We have trust of these patients because they already trust the medical store owners. They are able to
Hmm.
dispense medicines through digital prescriptions instead of just handing over medicines without prescription. They're even able to consult to doctors, senior specialists, that the patient would have to travel long. Also, they would even not have much knowledge about these specialists, because now in urban areas,
Hmm.
we still do not know what hyper specialist is. So leave
Hmm.
alone what they would know. They would only know a general physician and an MBBS doctor. For them, an MD medicine is as equivalent to an MBBS. So obviously there
Hmm.
is a lack of health literacy and everything that exists in rural. So now
Hmm.
these medical stores become the people that advocate these patients that are coming to their stores, that look, I have a doctor online. You're not getting well.
Hmm.
Why not let's consult a doctor? The fees only starts at 50 rupees. There's no big harm.
Hmm.
It's affordable. So they then help us in connecting with these patients.
So when you like first began, which was the first medical store that you connected with and in which area? Ah.
Right. So the first medical store that we partnered with is still with us, Vishal Medical
Hmm.
Stores, and he's based out of Barabanki in Uttar Pradesh. And because we
Okay.
come from Uttar Pradesh, we thought that this was more achievable for us in a way, because we understood the geography, we understand the people, and also it's the most densely
Hmm.
populated state in India. So
Hmm.
we started from
Hmm.
here itself.
Hmm. And what kind of challenges did you face? Were the medical stores open to it? And were the rural people forthcoming to accepting what you were offering?
Right. So we had to do a lot of footwork in here actually. We had to set up a lot
Hmm.
of camps. We had to make a physical presence to make them understand. And also when COVID came, what happened is 2019 when we did our pilot, we soon understood that people do need healthcare in rural and everyone cannot get
Hmm.
it. And COVID
Hmm.
put restrictions on traveling and even to
Hmm.
consult a doctor and seek, and there was overburdened. So what happened is that they did become a little familiar with telemedicine services because government was in itself also running certain programs. We also had helpline numbers and everything, so they understood what online consultation really is. But
Hmm.
being very honest, it was a big challenge in the start to really make these medical store owners understand what how it's going to really help them. So obviously, what has
Hmm.
happened is help them to gain more trust with their patients because today around
Hmm.
50% of our patients revisit in within 6 months. So which means that their
Hmm.
patients are being retained at their medical stores. They would have to
Hmm.
refer these patients out sometimes because they couldn't treat all patients and they do not have that
Hmm.
knowledge acquired because they all know they're only working as pharmacists, only working on an acquired knowledge that they would have
Hmm.
over the time, that what kind of
Hmm.
medicine
Hmm.
should I dispense or something like that. But now they have a
Hmm.
trust of a doctor. They have a team of doctors along with the TTEC OCM team, Online Chikitsa Mitra team, that can support their entire journey of the patient. So what we started, something is called patient relief support teams, and we understood that in
Okay.
rural or even in urban, people don't follow their prescriptions. We get fine if 3 days we feel fine. Okay, my fever's gone down. Okay, I will discontinue my medicine. I would go very poor about it and I'll forget it or something like that. But we wanted to ensure that why not you complete your course of compliance of your prescription adherence, and then let's see
Hmm.
what happens. Can we do that? Can we make that trust established with our patients? So our team used to call these patients to check on them, and we still do. We call these patients and ask them, are you recovering well? Is there anything that you felt uncomfortable during that consultation? Because today around 57% of our patients are women. We started with 22% of women. Today we have
Hmm.
57% of women patients in our online ticket summit, which is a great achievement. And we understood a trend that these women cannot go outside of their rural without a male
Hmm.
counterpart. And now we are able
Hmm.
to support these women and their health journey. And it's not just the reproductive, when they want to conceive or something, they have to consult a doctor. Is the regular lifestyle
Hmm.
diseases and regular checkups that a woman must have so that their conceiving part becomes very easy as well, because they would be
Hmm.
diagnosed about everything, any deficiency or anything timely, because anemia is something in rural which is quite common. We've understood
Okay.
because of the nutritional values and everything. That's what we understood with the doctors. That is quite common with the women. Um, Non-communicable diseases are also becoming very common and popular now in rural because of the lifestyle changes. The rural is also seen. It's not just the urban issue; it's also a rural problem now. So there has been a lot of shift since then, and I think patient support team has really been fundamental in establishing our support to these patients and ensuring they complete their prescription and compliance of the medicine course so that they feel better.
Okay. So how does this model work? Suppose I'm in that in a village and I
Yeah,
have some issue. I
yeah,
approach the medical store. What after
yeah.
that?
Right. Let's say you have an issue, you have some certain concern, you would visit the nearest
Hmm.
medical store who is registered and a partner of Online Chikitsa Mitra. They would first register
Hmm.
you on our portal with basic
Hmm.
information, your number and your name and details. They would take your
Okay.
vitals, which is very important, which we train them and we also help them with equipment. So we give them equipment where they
Okay.
measure your blood pressure, your weight, your height, your pulse, and your body
Hmm.
temperature along with height. And what happens, all this
Okay.
information is fed into the system. This goes to the doctor along with what are the symptoms you are currently experiencing.
Okay.
Like what is your
So
major
who's the
chief
via
problem?
media?
The medical
Who
store enters
like
all
the
these
patient?
information
No,
on
no.
their system.
The
Huh.
patient is talking directly to the doctor online, or it is the
Yes,
medical store
yes, it's a
attendant who
video.
is
No,
talking to the doctor.
the medical store only helps in inputting all these information. Like for example, when you go to a doctor in OPD, There's usually a nurse or a compounder that helps us with the basic information, ki weight le lo and de lo, and they write it on the paper prescription and they hand it to the doctor. Same way
Hmm.
in our platform, it is all happening digitally. The medical store owner takes on all these information, puts it into the system. A consultation is booked with whatever doctor they feel is required. In case he's not able to identify, he calls the team and says, the patient experienced this
Okay.
problem. What doctor would you suggest? So they would be able to
Okay.
choose from those specialists. And then after a consultation is booked, within 15 minutes, a video consultation is done with the patient at that medical store itself. So with you, for example,
Okay.
a video consultation face to face would be done with the doctor, where doctor would further counsel and understand what your concern is, how long that's been happening, and everything with regards to your health. And then he would write
Hmm.
a prescription. He would also mention what is the next follow-up date. Also, we have
Hmm.
7 days free follow-up for most of our doctors, where a patient, in case they don't feel well, they can come back within seven
Hmm.
days and see the doctor without spending any money.
Okay.
They only have to
Okay.
spend money for the medicine that the medical store may have to, if in case the doctor feels there's a requirement to change. But usually
Hmm.
3 to 4 days is every doctor that says that, follow the prescription for 3, 4 days and then let's see how you're feeling in case. And then in derma cases,
So
the
how?
patient would take 15 days or something longer, as depending on the prescription days.
Okay. Okay. So how many doctors are on board?
We have roughly around 50 plus doctors currently with us. We have a different
Uh,
platform now. So once we started
uh,
Online Chikitsa Mitra, the interface and
uh,
everything was only patient focused. What we understood with working
uh,
with doctors that they require different tools to work with. Also, their
okay.
digital friendliness, how to ease of writing a prescription online should be very easy because they've been very used to of writing on a paper and pad and pen with
Uh,
writing down whatever problems you have. So it had to be very
uh,
intuitive. So we came up with another platform which is called 120 by 80 last year.
okay.
This is a
Okay.
dedicated app for the doctors only. All MBBS doctors, they can basically enroll themselves. There's a currently a waiting list in there, but we enroll these doctors and we do a
Hmm.
little verification, understanding what their expectations are and everything will we be able to fulfill if they are happy to serve these rural patients. Mostly all doctors are willing to come on our platform. That's what we've seen. That's why we had to open a waiting list now. So yes, that's how we're currently working with the doctors front.
Why this 120 by 80 is the BP
Yes, exactly. You got it right. I
numbers?
mean, with the yes, that's the normal blood
Okay.
pressure. So that's how the name for
Normal.
120 by 80 came. Yes, for doctors, because we
Okay.
wanted only doctors
Okay.
to associate with it.
Okay.
Yes.
Okay. And all these doctors who are associated with you with the Online Chikitsa Mitra are offering services free of cost?
No, they charge. Some of them charge.
Mm,
Mostly all of them charge.
mm,
Their fees depend from 50. It goes from 50 rupees to 700 rupees. But these doctors,
okay.
because when they onboard, we tell them that we'll have to keep a fees at a little lower level, and these doctors are very happy to do that for us. So this has been very positive for us
Okay.
from doctor side as well, and very supportive.
Mm,
So we've
mm,
never been able to face any challenge on that front that, we had to just guide them a bit that, the fees has to be a little on the lower side because we are catering to the underserved areas basically right now.
mm, mm, mm.
And they may not be
So
very
how do
pocket friendly.
huh. So how do these two platforms, what's the connecting link between these two, 120 by 80 and Online Chikitsa Mitra? Where do they meet,
So the
the
doctor
two
uses
platforms?
120 by 80 and the patient side and the medical store is using the online Chikitsa Mitra app. So it's a different interface basically.
Sure.
So, for
Okay.
example, yes, if
Okay.
there's a doctor and you want to consult, the doctor would use 120 by 80, where they would be able to see everything about the patient, write prescription, and all the records because they're
Okay.
confidential. Whereas the other side, where the patient is seeing, that's another interface. That's it. There's two separate apps, but they're both connecting
Mm,
through a call together on a
mm.
video call.
So what I understand is that since your brother is from MIT, he has that computer software background. So he is behind the apps and all that technology.
Yes, yes. So
And
yes, he is behind the tech, entire tech.
yeah, and what's your role in that?
Right. My role is because I come from a sales and marketing background with my experience and
Mm,
expansion. So my role has been
mm,
to really go on ground, work on
mm,
the on the ground levels for expansions, basically. We're expanding our
mm,
reach. So when I joined, there were around 300 medical stores in 2022, and now we are 650 medical stores. So our focus has been to expand our reach pan India, increase the number of medical stores, increase our footprint, increase the number of patients as well.
mm. And how many states are you present across India?
Currently
Are
working
you
in
there in
15
all the
states.
states?
No, not all. 15
Okay.
states. Yes.
Uh,
The south
so
side we are
which
not
part
there.
is left?
Only Karnataka. The south and the east part is left.
Okay. So you have plans to make inroads there also?
Yes, we're trying to now slowly expand our reach, but first we want to establish
Mm,
our presence in these 15 states completely, and
mm,
then
mm,
slowly expand into other states as well.
mm.
But we're currently working in
And
Karnataka as well now.
okay,
Yes,
okay. And when you're like you're in Karnataka and you're also in you began from Uttar Pradesh.
yes,
Uh, what is the difference between what difference have you seen between the patients in rural areas belonging to because the education level, the other awareness level in the different states is different.
right.
Especially you were talking about women also. I want to know that what is the difference between the acceptability of this platform, say for a woman in UP and for a woman in Karnataka? Is it
Right.
same or
Yeah, right. So
different?
actually, to our surprise, it's been both have been quite challenging in itself. For example, let's say in North,
Okay.
first women they were quite open with it because once we did our groundwork in here in North, it became easier and women
Mhm,
started approaching and going to these medical stores. And also, these medical stores play a very fundamental role in encouraging patients to do online consultation because without their support, we'd not be able to reach these patients. So they are very
mm,
important key players in here. But whereas in Karnataka also, we were surprised that it was still an equally a challenging. Like we did get patients from Raichur, let's say, females we are getting, young females. They have the same kind of. We thought that they would not be facing any challenges or some, but early pregnancies and things like that. So our doctors have seen that, and we were surprised that it is coming from Karnataka. So I wouldn't be able. I can't say it really key that in North the women's are less educated and they are more in less informed, whereas in Karnataka they are more
mm,
informed. But no, it's not that. The consumer behavior is throughout same because there's lack of health
okay.
literacy. What we actually need
Okay.
know now in schools or anywhere, I would say, is to educate people and children about health, how to take care of their basic health, what is really important. That is missing, and that's a major concern that we've seen. So we've started now working, making these animated videos which can easily be circulated to these females and holding webinars for the females online, that they can be more educated about their health, because sometimes women are not very open as well to speak about their health. We've seen they're very shy, and also it's been a long-standing taboo as well for women to just go around and speak about their any health concerns without a supporting member from a family. So that is one challenge, and with our camps and awareness, we're saying let slowly this is changing for good, which is, but again, the
So,
importance is health literacy is very important.
so is there any state where health literacy is like remarkably low as compared to others?
I think it's at par when it comes to women
Okay.
health in rural. What we've seen, because we're catering them, it's all at par. Even in urban
Mm,
area, women still don't know many things. We are still unaware
mm,
about, this is not right and I must go and get myself checked. Even though we are
mm.
so accessible to all the information now, there is information parity, I mean, as compared to information asymmetry long back. Still, in spite of having an information parity, we still
Huh.
do not have access to that right information.
Uh, I think it's more to do with the women not being cared for in the families. No,
Yes.
their health issues are not of much concern to the
Yes.
family as such as compared to a male.
Yeah, because they do not
So how
have
do you
the
work around
courage
that?
to speak out also. So, because our patient relief team, as I said, plays a very important role, we speak a lot to these women to encourage them, to make them understand if you're not feeling well, you have to take rest. You cannot be
mm,
like, I have to see my farm, I have to go to the farm also, खेत में भी काम करना है मुझे, घर पे बच्चों को भी देखना है, सास और ससुर को भी देखना है.
mm,
But what about you?
mm,
Are you taking care? That is very important. And what are you doing? Because women are the pillar, these are the unsung heroes, I feel, in rural India, in every family. They only
mm,
are Their titles are only reduced to a mother or a sister or a wife, but these are actually the support systems of any family. And if they are not being taken care of, I don't know what we are doing. So this is why we started focusing more on women when I stepped in into, because that's what I saw, that these women were not coming out and speaking about their health. And in camps, they were coming in numbers when we were going in physically to discuss their issues in person with us. So we understood that we need to have more female doctors. So on now we have a lot of
mm.
specialists that are female other than gynecologist. So it's not just a gyno female doctor. We have a MD doctor that's a female. We have a general physicians that are females. We have cardiologists, dermatologists that are female doctors now, where women can
And
confidently
how,
come and speak.
uh, and how much change have you seen in the behavior of the women, like in the last 7 years that you've been working with them?
Right. So as I said, that 50% of our patients are coming back and 57% is female. So you can understand how many females are actually coming back
Mm,
for a revisit
mm,
and getting hooked
mm,
to that doctor. There have been a lot
mm,
of cases of non-communicable diseases as well. There was a recent case as
mm,
well where we
mm,
had the doctor actually from Bihar and the patient is from Karnataka, and the MSO
mm,
got the medical store owner, MSO we call them in short form, they got a consultation done, and the doctor said that she's had an angina attack. You need to get her operated ASAP, and this is what it looks like. Please consult or refer to
mm,
an hospital. If you need any leads, we will look into it, like any hospital reference or anything. And we were so
mm,
happy to know that a doctor where there is no barrier, is like language barrier didn't exist. Imagine a doctor from
mm,
Bihar giving consultation to a female from Karnataka, and she went under
mm.
a bypass and she was well and she's fine, doing well now,
Okay.
recovering well. We got a
Mm,
testimonial for the doctor and for us from the medical store owners and the patient, thanking us that we guided them timely and everything was done in efficient manner for them wherever they could reach out. So that these kind of testimonials actually keep us motivated, and we are seeing that shift, that that slowly we are able
mm,
to make a change. I mean, Rome was not
mm,
built in a day, as it said, and I think that's what we are
mm.
realizing every day we work in this sector. That slowly changes are coming. Yes.
Health tech majorly grew during the time of we had COVID pandemic, and from
Right.
then
Yes.
earlier the technology was not much. Maybe it was, if it was there, it was not seen. But after COVID, we are seeing a lot of innovation in health tech. Are people more, or even doctors, depending more on apps and digital platforms than the ground level delivery system?
Thing is, COVID taught
Mm,
us that the stark difference between what a secondary healthcare is and what a primary healthcare is. What all these healthcare platforms really are working on, if you look at, is primary healthcare
mhm,
sector. It's
mhm,
not secondary. Secondary is where we would require a physical examination. Telemedicine can
mhm,
only give you 70% of your illnesses can be treated online, but 30% still would require a
mhm,
physical examination. So it's not a
mhm,
replacement, it's just an enhancer
mhm.
to the existing
Okay.
tools that exist. And also the way technology is developing in itself, the kind of tools that are now developing, it's becoming very easier
Mhm,
for the doctors and the patient to access healthcare in a very smarter way. We are becoming more informed also from these apps now. I mean, a long back, how I don't think we would have ever thought that how many calories am I eating on my plate. But now I have an app which I can click a
mhm,
picture and know that okay, I'm eating these many calories. But again, the decision
mhm,
again depends on me. The doctor will tell me that track your calories. But if I am not taking that action of downloading the app, at the end of the day, I'll not be able to
mhm,
do anything. So technology is just the way technology is developing and evolving. I think as humans, we are also evolving a lot to adapt to these modern changes, adapt to the scenarios of tracking wearable Fitbits and other using other applications where we can track our health better. So I think we are making more informed decisions about our healthcare. That is very that's a very prominent shift that has been in these years.
Where do you see assisted telemedicine and medical store-led healthcare heading towards, like in the next 5 to 10 years?
Right. I feel it can expand quite long because, see, in India, there's one concern that still over the counter medicines are prescribed and they are being
Mm,
given by the pharmacist, and they may go unnoticed, especially in the hinterlands of India. So, expansion
mm,
of telemedicine is going to be, that's what we're going to be seeing because the shortage of doctors exists, and we do not know in near future how many doctors spaces or seats would be filled up and how quickly it would be filled up. So because it's a 5 year
mm,
of MBBS and then their training and everything, it's a time consuming effort. So technology would help in making healthcare more accessible and affordable at the
mm,
same time and reach to those who've been been long distant from right. Like it's a right. To right to health is also a person's right, I feel. We cannot be neglected, or it should not be a dream for us. Like it's not a privilege to be
mm.
taken care by a doctor or to consult a doctor. So, online consultations, telemedicines, all of this would evolve a lot at a greater speed in the coming future, especially with the AI tools that are now developing as well and under experiments and machine learnings. I think it's a space that will grow far and beyond.
And looking back at your journey, what has been your biggest learning as well as unlearning from automobile to healthcare?
Right. So the biggest learning I would say has been that that trust cannot be bought overnight, or trust is not a ship that you get it from somewhere. Trust has to be built
Mm,
slowly, and especially in healthcare sector, it's very important when you're working with everywhere any person. So trust is very
mm,
important, and you should your resilience is also very important because sometimes you'd be questioned why you're doing it. What there's no
mm.
change that I see, but you should keep on believing in yourself. That's very important, I feel, as a co-founder, that one must not forget that why you started off in the first place.
And what
And
has
for
been your unlearning? What did you have to unlearn when you moved from automobile industry to healthcare?
right, one thing that I had to unlearn quickly was that we've been in a bubble, literally, of how things would existed, and
Mm,
that bubble burst, and it was quite hard as well to really understand what we are and what the scenario actually looks like on the ground, and what we're doing in here is very different from what it looks on the paper. So when you are in automobile industry, you're looking only in and out on the sheets and spreadsheets and papers, but once you start interacting
mm,
with real humans and understanding what the ground is for them, it's quite a lot
mm,
of unlearning that you have to do then in your ethics and
mm.
business principles and everything then.
So if you look 10 years ahead, do you believe like India will be still solving the last mile connectivity issue, as we say, between the doctor and the patient, that thing, or we would be still working towards it?
I think
What
we
are
would
your
should be able to close this gap as much as we can. Specifically, I would say because the expansion of internet and reach of digital tools in India
mm,
everywhere, and how smartphones have become so accessible and user friendly also for these rural people in the underserved
mm.
areas, that reaching the last mile patient would also become very easy using technology now.
So you're hopeful that things
Yes.
will definitely improve.
Yes, they will, and I feel they already are because the kind of people that we're serving, we're doing around 1,200 consultations a month, and
Uh,
mostly from Uttar Pradesh, and that's what we are seeing the shift as well. That the impact it is creating, and then the references that get generated from it.
mm. So across India, how many patients are there?
So we've done almost 1,60,000 consultations online.
Okay. Okay.
Yes.
And do you have any plans to move to like urban areas, like catering to urban poor?
Right. So we are also working. We've launched our app as well, mobile app for urban
Mm,
area this
mm,
year. It's just that we didn't start promoting it really much, but we are promoting it slowly to understand what the geography looks like. But yes, in urban areas and
mm.
semi-urban, I would say, we are using our application where patients do not have a medical store near them and they have a smartphone access. They can now consult a doctor through their mobile phone itself. Also, their health records get saved as well and everything.
Okay.
So
It's the same name, Online Chikitsa Mitra, or
yes,
something
online
else?
Chikitsa Mitra app. Yes, even you could download it. It's available both on iOS and Google Play.
And it's a free app.
The app is free. It's just you have to pay for the doctor's consultation.
Huh.
The app is completely free. All your information, your even your blood reports, all these papers and
Mm,
everything what you've seen is scattered everywhere. Also, what we've developed for
mm.
urban area is something called custodians. What happens is basically
Okay.
because me and my brother, when we went out to study, we were not able to really be a part of our parents' health journey they would be having here because they were also in their 40s then. And but now as a custodian, I could take care of my parents' health as well by by telling them, okay, I've registered and added them as my custodian. I'm their custodian, and I have access to their health records as well. So I know what is happening, what consultation if they are having online, what happened in there, what is the prescription saying in there, is there any blood works to be booked for them, or what did the blood reports if they came, and then they can download the blood works there for their parent, for our parents, and the doctor can then access those reports on request. So if the patient allows, I allow them that okay, fine, the doctor can access my report. The doctor will also be able to access my report and give me a consultation on it. So we're trying to build an ecosystem where even everyone in the urban can also use it more friendly.
And one last question, Smriti. See, healthcare is not an easy field, है ना?
Yes.
Uh, Seeing patients and day in and day out, it doesn't bode very well for a person's mental health also.
Mhm.
What keeps you motivated?
I think, as I mentioned about the testimonial and the amount of impact that we're doing, because we have a relief ratio about 88%. So 88% of the
Mm,
patients that have used our consultation services have felt relieved. Also, at the end of the day, we need to understand whatever work I do, we can give our
mm,
100%, but sometimes in these cases, the results can be in different ways. They would require further physical examinations and things like that. So we have to be very quick in taking those decisions. And then
mm.
as any co-founder, at the end of the day, you have to keep your peace of mind, you have to keep other creativity of your sites to keep yourself engaged for that mental peace and everything. Do something that really makes you happy at the end of the day. That is very important to give some time to yourself too.
And is that what makes you say that the journey is worth it?
Yes, the journey is worth it because I keep saying that. Yes.
Okay. So thank you so much, Priti, for talking to me. And
Thank
thank you so much for the app that you've launched for rural India and the amount of work that you guys are doing. It's remarkable. And I wish more people take motivation and encouragement from you and your team and work in these areas. I also hope women, not just in rural areas, but in urban areas, also cities, also take care of their health better.
you. Yes.
So, what we learned today is that technology or the scale uh, matters, but not as much as the intent of the people behind it. It's the
Right.
intent that matters more.
Exactly. Yes. Absolutely.
Yeah. So, thank you so much once again, and all the best for all your
Thank you.
expansions across India.
Thank you. Thank you so much. It's been a pleasure talking to you, and thank you for hosting me today.
Yeah,
Thank you.
same here. Thank you.